Okay, so part of what we do at Heroes Diving for the Sea is we help advocate for our veterans and first responders. We're supposed to have a group of advocates that help us out with all sorts of things, medical issues, retirement benefits, disability benefits, those sorts of things. So right here on the Department of Veterans Affairs website, they actually introduce you to the patient advocacy program. And it sounds fantastic. If you need help getting care or getting your problem resolved, talk to a patient advocate at your VA medical center. And if you click on that, it takes you right to a map showing you where they are. We want to provide you with world-class veteran customer service. And this is just one important way in which we do it. Okay. I mean, that sounds reasonable, right? You've got advocates. People are there. They're going to take care of you. If you've got a problem, you talk to your patient advocate, and they're going to work through the system and help you out and get stuff taken care of. Yep. That's what it sounds like. That is not the case. That is not what happens. So I'm going to tell you my story that started about 2 months ago. So I tell people sort of jokingly, but not really, that the way I get through the day is with caffeine, hate, and opium. So the reflection on that's hard to see. So these are Belbuca or buprenorphine pain patches. And so what you do is you open them up, shove them in your cheek every 12 hours, let them dissolve for about 30 minutes. And it's one of those treatments. It is you don't take it as needed, you take it constantly. You don't want to miss doses because it takes a while to build up in your system. There's all sorts of things. I mean, especially when you're dealing with chronic pain and Schedule 3 narcotics, you got to take it the way you're supposed to take it. You've got to take it as often as you're supposed to take it. You most certainly should not be cut off of that stuff cold turkey. Really bad for you. So somehow, somewhere in the VA system, my medications were cut off. Not because of anything that I was doing, or even a doctor's order saying, hey, you don't need chronic pain medications anymore. You're just fine. Nope, wasn't that. Somebody went in and I had a prescription for another drug called bupropion. Buprenorphine and bupropion. Bupropion? Burpum? Yeah. They're spelled a lot alike and they sound a lot alike. But regardless, so somebody went in and cut off the other medicate, or was supposed to cut off the other medication because it wasn't working well with me. So instead of shutting that drug off, they shut off my chronic pain medications. Okay, that's a problem. You can't get them refilled. When it comes to Schedule 3 narcotics, you can't have a stock of the things. So they will only send you out a 30-day supply. So about every 2 weeks, you have to call into the clinic. Believe it or not, yeah. You call into the clinic, get a hold of somebody there, and then they refill the prescription for you. You can't just do it through the online system. You can't call and leave a message. You have to call and talk to somebody. That doesn't sound terrible either. However, the chronic pain clinic for the George Wallen Salt Lake VA medical system goes from Idaho Falls pretty much to Cedar City, Utah, and then goes pretty far east and west. So it's a massive footprint. And the only place you can get chronic pain medications for all the veterans in that footprint is the pain management medicine clinic at the hospital itself. And I think there's 2 doctors that work in there, a couple of nurses, a couple of people answering the phone, total maybe 8 people total in the clinic to deal with thousands of veterans with chronic pain. Now, I want to just make it clear to everybody, most of us have some level of chronic pain. Your doctor can prescribe certain things, your primary care team, typically ibuprofen, naproxen, Tylenol, things like that. But once you get into the narcotics for treatment of chronic pain and chronic severe pain, you have to go through pain management medicine. Okay? You'd think that they'd have a pretty good sized clinic, that things would work out pretty well, but no, that is not the case. So when it comes time to get on these medications, it takes a year typically. And that's not an exaggeration. People who need it, not people who are, chronic complainers and whiners about, every little ache and pain. No, people who need this stuff just to function, just to be able to stand up in the morning before, noon or 1 o'clock. And I'm in that group of people. When I get up in the morning, I can hardly walk. I can hardly move. I'm usually awake for 3 hours before I'm functional, even enough to brush my teeth, wash my face, just the morning routine that most of us take for granted. I can't really do it. Pain meds have got to kick in before I can really be functional. And my doctor knows that. The nurses at the clinic know that. So once I found out that my medication had been canceled by some other provider because of a mistake or a mistake at pharmacy, I start calling and calling and calling. Nothing. No response. I left probably 20 to 30 messages and nobody ever called me back. So finally I called the switchboard, the main, switchboard for the VA hospital, the VA healthcare system for all of Salt Lake. And I'm told that the phones at the chronic pain clinic, along with their email systems, have not been working for several weeks. And they are getting hundreds of calls and messages from other veterans who are having the exact same problem that I'm having. Okay? You'd think that that would be a priority for somebody to go in there and fix that, right? But no. It's not that it can't be done, and it's not that the system is broken, and it's not that something bad happened. It's the complete and utter lack of give a shit and urgency to help us out. So I keep calling. I'm told for another 2 weeks that they're still not, that the system is working, but they're still not getting messages, and they're all backed up and backlogged. So finally I get to the point where I can leave a message on the phone system, leave a week's worth of messages, nothing, not a word. Finally, I called the VA police. There are cops that work in the VA hospital systems. I'm told very quickly that their job is not to be a messenger service. I explained to the very friendly Marine on the phone, who was one of the VA police officers, what was happening. And he went over and hand delivered a message for me to give me a call. Next day I get a call. So I'm told that everybody is out because of COVID, the entire clinic. So I didn't even get a call back from pain management medicine. I got a call back from somebody from somewhere else. I don't even know where this person worked, but at least somebody did something and took a message over there. All right. So I have an appointment right after all this is going on with my primary care team and with my psychiatrist. I tell my primary care doctor what's going on, and there's nothing he can do. He cannot prescribe chronic pain meds. He can't prescribe narcotics. And he also tells me that there are approximately 2 people that are certified to prescribe this drug in like 3 VA healthcare districts. So how do we let that happen? How do we solve that problem? What do we do? Okay. So fast forward a little bit, a couple more days, and this is at 6 weeks at this point. I am cold turkey off my chronic pain meds. Fortunately for me, I don't have an addictive personality when it comes to drugs, alcohol, and chemicals. Maybe in other ways I have addictive personality, but not those. So I'm drinking heavily. I mean, alcohol helps. It numbs everything. It's certainly bad for you in a lot of ways, especially with the amount I was drinking. I mean, I was going through a couple liters of vodka every few days. It was a massive amount of alcohol, but that's what it took just so I could function enough to do the basics because of the pain that I live with on a general basis. Finally, somebody says, well, you should call the patient advocates. They'll help you out. So right before I'm ready to call the patient advocates, I get a call back from the pain clinic, and I'm told that they're going to refill the prescription. It'll be in the mail shortly. So the prescription goes in on the 16th of the month. and then I start the waiting game again. 9 days later, I get the smaller dose. I have 2 doses, 150 micrograms, 300 micrograms. I'm supposed to take the 150s at night, the 300s in the morning. So I get the 150s. 2 days later, I get the 300s. So after the prescription is filled, we're still talking a couple more weeks for it to get to me. And I'm told, well, the pharmacy is backed up. They're having problems and none of the prescriptions are getting filled fast. All right. Okay. Maybe you should prioritize, life-saving drugs and chronic pain drugs if you're having those kinds of problems, but apparently not. Again, the lack of give a shit is staggering when it comes to these people and it comes to the system. So I called a patient advocate. 2 days later, I get a call back. And the message I left for the patient advocate was, hey, this is horseshit. I'm going to start calling my federal delegation, my senators, my representatives, and I'm going to let everybody know what's going on because you guys are clowns and this is ridiculous. Nobody should have to go through this, not just veterans. Nobody should have to go through this. So this is the message that I received. Oops. See, again, technology hates me.
The patient advocate office at the VA in Salt Lake trying to reach Mr. Kenneth Condon. I got your voicemail about the medication. Okay, so I do have the ability to reach directly at the pain clinic and let them know.
They'd already talked to me at this point. So he's calling them to tell them that they need to call me a couple days after they called me.
Seemingly was removed arbitrarily for some reasons that don't make sense. So I know that it is your prerogative to reach out to senators and federal representatives from one vet to another. I understand that expectations for level of care and how things should be communicated to us. So for that, I'm apologizing that didn't happen. But
okay. Does that sound like he was my advocate or advocating for the people who screwed up, the people who weren't doing their job, and for the VA itself? Now, you guys decide. You tell me. I'm pretty sure he was trying to shame me using the, from one veteran to another card to not reach out to my federal delegation. I can't think of really any other reason for that phone call for that way. So fast forward a little bit more. This is even better. It gets, believe it or not, this story gets worse. So I'm supposed to have an appointment with my pain management medicine doctor. And again, you have to talk to them on the phone every 30 days. You have to see them in person every 90 days because the law, some law, it's not a VA rule, it's federal law, says that pain management doctors have to see you in person every 90 days. So for me to get to him, I have to drive a little over 3 hours each way. I've made this trip several times and I've had the appointments canceled as I'm within 30 minutes of reaching the clinic, saying, oh no, he's out sick, or oh no, there's a problem at the clinic, so we can't see you today. So right before I'm supposed to go to my appointment, I get a phone call. My appointment's been canceled because my doctor is sick. Okay. And you'd think they'd get this rescheduled fairly quickly, but oh no. So it's the first week of October right now, and my next appointment is scheduled for the later part of November. So aside from, the being off my meds for a long time, I also needed the levels adjusted. And I need to go up in dose because even with what's going on right now, even having the pain meds back, I'm still in a tremendous amount of pain. The VA gives you a scale from 1 to 10. Where would you rate your pain? And I'm at a good solid 6 right now, which is well out of the therapeutic range. Nobody should be that way unless, you got hit by a car or something. for me just to sit here and talk to you right now is excruciatingly painful. My hips hurt, my lower back hurts, my shoulders hurt. So I call in, I leave a message, and it was like a 15-minute conversation with one of the nurses asking me for all sorts of details. What's going on? What are my problems? What are my symptoms? What are my pain levels? Are they better or worse throughout the day? It was a detailed conversation. That was 5 days ago. I got a call today saying that my pain management medicine doctor doesn't want to adjust my levels because I was off my meds for so long. I was off my meds because of them. I had no choice. I had no recourse. I had no outlet. There was nothing I could do to get my pain meds refilled. Now, I'm going to back up a little bit and go back with the patient advocate. When I finally got the guy on the phone, he told me that the procedure is for him to go to the pain management clinic, tell them what the problem is, and let them correct it. So after he calls them, after I'd already talked to him, I got my prescriptions restarted. He didn't do a damn thing for me. Didn't make any difference at all in my life. This guy literally tells me that the people that screwed this up are the ones that get to fix it, and it doesn't go up past them. It goes to the clinic. That's it. It doesn't go to the hospital management. It doesn't go to the director. It doesn't go anywhere but them. So what I come to find out is they thoroughly investigated themselves and found themselves to be without fault. That's what we deal with every day. Every day. And it's not just that. Like I was talking about with the dental stuff. Yeah, I went in and I had the, from, my previous video, they looked at it, said, yeah, tooth is infected, and it's partially because of the implant. And so I need to go see an endodontics clinic. And so they call, they get it scheduled, everything's ready to go. But the VA has not returned a phone call to approve it. And there's a number for the patients to call to talk to the dental clinic for pre-approvals. And I called every 15 minutes all day. And not only did I not get a message, every time it sounded like they were answering the phone and then hanging up. That might not be the case. I don't know for sure. But that's what it sounded like to me on my end. So part of the reason that I'm in so much pain is my shoulders hurt. They hurt like crazy. Lifting my arms above about elbow height is unbelievably painful. As part of this, when I was supposed to go see my pain management medicine doctor, I was scheduled for x-rays and an MRI. But with that appointment being canceled, they just pulled the plug on the other two. Over the past couple days, I've been receiving letters from the VA. The first one was dated 9/30. The second day was 9/29. The one that's dated 9/30 actually arrived the day before. The one dated 9/30 came a day before the one dated 9/20. So the first one says MRI for upper joint extremities. We've been trying to get a hold of you. We can't get a hold of you. So if we don't hear from you within 14 days, and I'm obviously paraphrasing here, the referral is going to be canceled. Okay? So this is the letter that was dated before the other one. Yes, dated before the other one. So then I get the second letter the next day saying that I have an appointment at the Salt Lake VA Medical Center for Wednesday, October 15th at 4:45 p.m. Seems a little late, right? Okay. But they scheduled the appointment for me. That's fine. The appointment's done. Today, I get this. My appointment's been canceled. right? So for every simpleton and halfwit out there that calls the VA the gold standard of care, just know, anybody advocating for single payer and socialized health care, no, this is what you get. If they treat us this way, and by us, I mean those of us who were dumb enough to stand up and defend our nation when called, thinking that we would be taken care of afterward. I don't regret my service. I'm a patriot. I'm not saying don't join the Army, the Navy, the Air Force, the Marines. Okay, maybe not the Marines, but hey, anyway. Nah, just teasing Marines. But the indignity of what we have to face and what we have to live with to get medical care because of what happened to us while we were serving our nation is unbelievably ridiculous. This isn't me. I wasn't out riding a motorcycle and crashed and, hurt my shoulder. No, this is injuries. These are pains from my service. And I'm not just a veteran. I didn't have just an office job. I mean, I'm not saying those aren't important jobs. I'm a combat veteran. I'm the guy that's watched a kid, 19-year-old kid, get a 30-ton vehicle launched in the air from an IED right in front of me. I've had bullets fired at me. I've had mortars dropped around me. These pains are from service. They're from combat service. So the point to all of this is what happens to us. We need the government out of our healthcare as much as possible. Instead of having the VA Medical Center, how about we drop it down? We have 10 people who deal with billing. So when we have a medical problem, we go to our community care doctor and the VA just pays the bills instead of this monumental mess of nonsense. Get away from single payer. Support your local doctors, support your local nurses in your local hospitals. Avoid this stuff. If this nation goes to single payer, I promise every idiot that voted for that and that pushed for that, you will reap the same benefits that veterans reap for our service to our nation. And that really sucks. All right. Well, we're going to do some more videos a little bit later, but I know that wasn't uplifting and that wasn't happy, but that is what we get with single payer. So everybody have fun, be safe, take care of yourselves.